think what we find is no different than what really, people have been researching this for the last 15 years find. And one is that our female athletes obviously are at greater risk. And there are certain sports that are at greater risk. Soccer athletes are at greater risk. Female basketball players are at greater risk. Obviously, our football players are at greater risk. So when you look at risk factors related to demographic information, their age, their gender, but also one of the interesting things that we're finding is concussed athletes. So one of the things that we've been seeing some trends in is that our concussed athletes, because of the vestibular issues that happen with that, because of the balance issues that go along with that their single limb performance is horrible. And what we do know from the research is that single limb performance is critical in identifying those that are at risk for ACL injuries. And so one of the things that we're seeing is that those concussed athletes, their single limb performance is horrible, which we speculate or hypothesize is probably putting them at greater risk for an ACL injury. But the other thing that we're seeing is that those same concussed athletes are also reporting a significant increase in the number of non-contact injuries of their entire lower kinetic chain. So an increased rate of ankle injuries, increased rate of knee injuries, increased rate of hip injuries, all related to or which started around the time after the initial concussion. And we see that more evident in our younger athletes, 10, 11, 12 years old, than we do our Division I athletes. For some reason, the younger brain is more sensitive to concussions. I would say first and foremost, learn what the movements are. It's not rocket science. It took a lot of really phenomenal researchers to pull out what these movements are. But once you identify them, one of the things that we do is we record an athlete on video so that we can show them what they look like. And when someone sees how they move, that is a critical piece to them actually changing the way they move. So first and foremost is really giving them a visual cue of how they move. If I tell you, you move like this or you move like that, it's totally different than when you actually see yourself on video moving. There is something psychologically that goes along with that as well. And there's something with the connection that goes on there as well. So really educating people on how they move, and then don't let it happen. If you're gonna go to the gym and you're gonna do single leg lunges, don't let yourself move into a dynamic valgus. And you know what? If you do, maybe you should bring that exercise down, or maybe you shouldn't do that exercise. Because if you do that and you do it over and over and over again, all you do is you train yourself to do that when it matters the most, when you're on the field. So that your movement pattern that you're gonna tend to move into, if that's what you train, is that movement pattern.